This segment of DelmarvaLife is brought to you by TidalHealth.
You know, as our population grows and ages, the demand for physicians also grows. So the result is an estimated shortfall between 37 and 124,000 primary care and specialty physicians by the year 2034.
So it goes without saying, doctor shortages pose a real risk to patients, especially for those in rural and underserved areas. Here's the good news. TidalHealth is on it.
TidalHealth recently launched its graduate medical education program. It's a win-win for doctors and patients on Delmarva. Dr. Simona Eng is Associate Vice President of the Medical Education in TidalHealth and joins us this afternoon with more. Thank you so much for joining us.
Thank you for having me.
So tell us about this program.
So just for the audience to understand, medical education has a lot of acronyms. And graduate medical education, or GME, refers to a period of time that involves training in a specialty, which could be a residency, or it could be a subspecialty, which is a fellowship. And that occurs after somebody finishes medical school.
So what are the primary goals for the program?
So the primary goal is really to attract and retain physicians in our community, because we do have a huge physician shortage. And we know that because we do a needs assessment every 3 years to look at our community. Who's retiring now, where we're going to be in 3 years, where we're going to be in 5 years. And we have gaps in a variety of subspecialties, but particularly in primary care, psychiatry, even pediatrics. So we're trying to fill all those.
So what's the approach with the program?
So we have a journey, and we started with internal medicine as our first residency program. It's a 3-year program. We matched 10 residents our first year. We're in our second class of 10, so now we have 20. That serves as the basis for a lot of medical subspecialties. So if somebody wants to do cardiology or gastroenterology or endocrinology, they have to do internal medicine first.
Right.
And that's another 3 years. So if you want to do cardiology, after you do internal medicine 3 years, you spend another 3 years doing cardiology.
Yeah.
So it's more and more training, but it's good for the community. And so that's what we're trying to do.
Yeah.
So how does it prepare graduates for the ever-evolving landscape of healthcare?
Yeah, healthcare has gotten more complicated. Our curriculum is really based on competency-based medical education, where really the center or the hub is the trainee, the resident, or the fellow. And so what we try to do is we get the residents and the fellows involved in working as a team. If it's like, we call it transferring information effectively, and in order to do that, you need to communicate effectively within the team. So that means talking to the nurse, talking to the case manager, talking to patients, talking to families. It could be a pharmacist. It could be the next level of care. It could be a rehab facility. It could be the primary care's office or a subspecialty office. So we train the residents and fellows to work as a team in that regards.
So talk to us about the faculty and the mentors.
Yeah. The faculty are all board certified.
Yeah.
They come from, coast to coast, north to south. They all trained at large academic centers. They are highly engaged, which is a tremendous relief for me because we need faculty involvement to make this work. And I think a lot of them do it because they want to pay it forward. And in order to do that, they want to train the next generation because we're all getting older and there's not enough of us to take care of the community. So we want to train the next generation.
Speaking of the next generation, where do you see this program in 5, 10 years?
So hopefully in the next 5 years, we'll probably have roughly 200 residents and fellows within our institution, running around, training, learning, taking care of patients. And we hope that majority of them will stay with us on the Eastern Shore.
So why do you feel this particular program is so important to the residents of Delmarva?
So I think building that pipeline, we talk about this shortage, and we feel it the most because we're in a rural, underserved area. And I think as we look at the larger picture, we can try to recruit from the outside, but unless you're from here, it's a little challenging to get folks to want to live here. Even though I am a come here, I came here 23 years ago, and I love it. But to get people to want to come here, I think we need to start with a training program.
Yeah.
The minimum is 3 years. They get to love it. They stay longer. They complete, further training, and that's kind of what we want to do. Yeah. So it's important because we also bring in more technology. When we have training programs, we can acquire advanced technology quicker because we don't want any resident or fellow to be trained any differently than if they were across the bridge,
right,
2.5 hours away.
Yeah.
Because I want them to practice in any setting.
That's wonderful. Definitely a win-win for everyone involved.
Absolutely.
Dr. Simona Ng, thank you.
Thank you for having me.
coming in.
Wonderful.
It's a wonderful program.